Good morning, everyone. This short interview is going to be concerning those practices that are interested in a moderate complexity CLIA lab or already have a moderate complexity CLIA lab who are interested in performing FISH, Urovysn FISH, or similar tests in your office. If you're already doing that, listen up. And if you're interested in doing this, definitely you want to listen. For those of you who don't know me, my name is John Lin. I'm a urologist in Gilbert, Arizona, but I'm not in Gilbert, Arizona today. I'm here in Tucson, Arizona at the Arizona Urologic Society meeting. I'm very happy to be with Cellay, that's a company which has innovative technology which may be a substitute for FISH. If you perform Urovysn FISH in your office or if you send it out, there are some opportunities that you may want to listen to John in sharing with us. So thank you so much for number one sponsoring as one of the sponsors for the Arizona Urologic Society meeting, and thank you for sharing this technology.
Oh, my pleasure. Thank you.
So tell us a little bit more about Soleil. What is it and how does it work?
So Soleil has developed same-day oligo-FISH technology. So this is a very cost-effective way for labs to bring in FISH testing into their in-house lab. We looked at, with our technology, how to apply it. And so we looked at looking at Urovysn, how to improve upon Urovysn. And so our technology allows the labs to, I'm sorry, John.
Yeah, that's okay. Yeah, you're allowing, basically, instead of having people performing FISH, or if they do run FISH in their own labs, this is an alternative from what I understand.
Correct.
And first of all, the turnaround time is apparently really, really short. Tell us a little bit more about that.
Our technology allows an entire FISH process. It's less than 2 hours from start to finish. So we wanted to give a robust assay and eliminate some of the errors that you see with Urovysn. So our assay is performed at room temperature. And again, the hybridization time is 10 minutes. So the entire slide processing to end is less than 2 hours.
So that's wonderful. So that's one benefit. And the second benefit would be potentially cost, right?
Absolutely. The technology allows us to manufacture at a very reasonable price. So in turn, the overall cost to run the assay is around $80 a test.
And I mean, ideally, everyone should be running this in the office, but there are some hurdles that you have to overcome because that particular payment for the CPT code that's assigned to currently that one specific test, right, that one specific FISH test, you have to undergo a little bit of a testing and validation process before Soleil can be used and billed under that code.
Correct.
Tell us a little bit more about that process.
So under CLIA regulations, the lab is allowed to bring in their own laboratory developed tests under proper validation. So the test, basically the lab would validate perhaps a concordant study against Urovysn and show that it's similar results to the Urovysn gold standard.
So basically, you want to make sure that your test yields the same results as Urovysn, so that it's a benefit to the patient, and in this case, it will be a good benefit for the office. Faster turnaround and less overhead when you can deliver the same type of a result.
That's correct. And during this whole process, we wanted to try to improve the clinical performance of the test. So we looked at perhaps different chromosomes than the Urovysn test, and we decided that chromosomes 3, 6, 7, and 20 gave more optimal clinical performance. And this was based on some research that we did. We were looking at chromosome 20 specifically as a chromosome that becomes aneuploidy very early on in bladder cancer. So this was important for us because one of the deficiencies we felt of Urovysn was the lack to detect low-grade tumors. Another way that we integrated, tried to detect low-grade tumors better, was to change the scoring criteria of the test. So instead of taking the test to a positive, negative type of test, we wanted to try to gain more information. So the more information that we're looking at is percent positivity. Yes, this test, the patient is positive for the FISH test indicating bladder cancer, but we wanted to make a correlation between percent positivity and some type of prognostic information. So where we're looking at scoring, as many cells as we can, and so automation sometimes helps with this. So if a lab has automated imaging systems, this really aids in that effect too. And we're also looking at the differences between multiple chromosome gains versus single chromosome gains. That's something Urovysn does not look at, and the result of this is allowing us to again give information on tests that are borderline positive or perhaps in a precancerous or low-grade type of situation.
So anytime you introduce a lot more data, it certainly introduces potential complexity in the interpretation of the data, and that may be a concern for those who just want positive or negative. Yes. Or for those who are a little bit more sophisticated, they appreciate the nuanced information that you're providing.
It's all about educating and understanding the data, correct, and how to apply that. So
it's not like pregnancy, You're pregnant or not pregnant. Right. You're on the plane or off the plane. That's why I never understood pre-boarding. I don't understand pre-boarding. Anyway, so
one of the issues with Urovysn in the very beginning was anticipatory positives. So we have to distinguish between a true false positive and an anticipatory positive. An anticipatory positive is the result of the molecular test actually being more sensitive than the gold standard. So in certain situations where you're getting borderline positive tests or very low percent positivity, this would indicate perhaps that you will not see anything on a cystoscopy, because we're at the stage molecular where the cells are starting to become aneuploidy on the molecular level, but they're not at a stage where it's proliferated out.
Yeah, it's almost, but not quite there yet. So now with your test, you have somewhat of an ability to kind of detect that and predict potentially precancers.
Correct. And we've done studies...
Or previsible cancer.
Absolutely. And we've done studies where we followed these patients in the FISH testing over time, and we've seen where certain circumstances where we get the positive FISH and negative cystoscopy, when we follow up 3 months, 6 months, 12 months, we start to see a correlation between a positive FISH becoming more positive, percent positivity increasing, and positive cystoscopies.
So that's interesting, right? Because instead of just jumping into, okay, we're just going to take the patient to the OR, incur the anesthetic risk, financial risk, now you have a way to kind of say, well, how positive is it? What is the trend of this positivity, instead of just saying yes or no, right?
Correct.
As with the current test. Now, for those practices that do not want to invest in a fluorescent microscope, which can be costly,
yes,
right? There are other opportunities. For instance, you can split bill. Correct. Meaning, tell us a little bit more about that.
Yeah, so we partner with anatomic pathology labs, and so they're utilizing our test as well. And in that circumstances, we can offer TCPC type of arrangement where the test can be performed in-house and the pathologist can read.
Pathologist can give you the read, and then you can just actually perform the technical component.
The technical component and bill for that as well.
So not all is lost if you do not have a complex CLIA lab, or if you don't want to have that total complexity, if you don't want to invest in the more expensive microscope, you can still possibly look into this particular test and possibly get some gains for your patients and also for your bottom line. So as always, any questions or comments, leave them below. Have a good one. Bye-bye.